Hello, I'm Dr. James Zender, and I'm pleased to share some information with you about my practice. Since the late 1980s, I've specialized in psychological trauma care, and in the last 15 years, I've specialized in auto accident trauma. People who have been in serious car accidents often have multiple physical and psychological injuries. Just dealing with one injury can be very challenging. But when someone has multiple injuries, both physical and psychological, the recovery can be daunting and frightening. They require a comprehensive treatment team in order to achieve the best outcome. People who have not been involved in auto accidents will often be surprised at the number of professionals involved in developing a comprehensive treatment approach. Often there are problems such as visual issues that require an evaluation and treatment by a neuro-ophthalmologist. Often there are spinal problems, neck, shoulder, that require treatment by an orthopedic specialist. There are physiatrists. There are pain managers, sometimes dentists who specializes in TMJ, physical therapists, occupational therapists, aquatic therapists, massage therapists, neurocognitive therapists. I can go on and on. Recovery will not happen overnight, but with the right team of competent, professional, and ethical professionals, you will be pleased with the progress you make over time. It's really important to maintain a positive outlook that you're going to get through this and that it's a great challenge, but with great challenge comes great growth. And many people who have been in serious accidents, as hard as it is to believe, in looking back at it after they've recovered, they come to see it as a blessing. The second thing that's really important to remember is self-care. I see self-care as really being central to all therapy work, regardless if it's a car accident or other issues. People forget to take care of themselves, basic self-care, getting enough rest, eating properly, staying connected to friends and family. Basic self-care is really essential. And the third element is being open to receiving help. When you're injured in the car accident, there's going to be a lot of things that you can't do anymore. And so for a lot of people, the loss of that sense of independence is really difficult. But it's very, very important to remember that you're going to have to allow other people to help you and to assist you. When I was a child, a relative gave me one of these. It's a Chinese finger trap. And I was probably 3 or 4 years old, and I stuck my fingers in it. And I tried to get them out, and I was terrified. I thought I'd really been tricked. My fingers are going to be in this thing forever. And finally, they instructed me how to get my fingers out, and what a relief. And I find that many of the conditions that we get into when we've been injured or we're in a difficult situation, we don't know how to let go and release. And instead, we keep pushing ourselves deeper and deeper into the difficult situation. Once we can accept what's going on, a lot of the burden is lifted, and then we can move on and find our options. Some of the conditions that people have following an accident are post-traumatic stress disorder, mild traumatic brain injuries, pain disorders, depression, and sleep disturbance. Often even a minor car accident can have an impact on brain functioning. Mild traumatic brain injuries, which are often very difficult to diagnose and often are missed. Brain injuries have been referred to as a silent epidemic because they are very difficult to determine. They cannot be seen on MRIs or CT scans or X-rays. It's only through behavioral observations and self-report that there is an initial detection of a problem. Common problems are headaches and sleep disturbance. It's very hard to function when you can't sleep. Often sleep is disrupted due to anxiety, worrying, and pain. Pain is a big culprit in causing sleep disturbance. It makes it very hard for the brain to heal and recover when you're not getting rest. If we do detect signs and symptoms of a traumatic brain injury, it's very important to make referrals to the appropriate specialist. This may include a neurologist or a neuropsychologist. One of the gold standards of determining the nature of a brain injury, if it is a brain injury or if it's due to other factors such as emotional factors or sometimes medication factors even, is the neuropsychological evaluation. One of the most common causes of post-traumatic stress disorder, believe it or not, is auto accidents. Often there's a sense of deep isolation, which makes you want to withdraw, and that is the worst thing you can do. This is where things like individual therapy and group therapy with other people who are going through similar things can be extremely helpful. It's amazing to see how good people feel when they've been feeling isolated and then they enter group therapy and see they are really not alone, that their symptoms are very common and everybody's going through similar things. If you have been in an accident, it's often very difficult to take in a lot of new information. And I've given you a lot of information today about the recovery process. Both you and your family and friends have been shaken by this event, and you need information and you need support. When you see a psychologist for therapy, it's very important that you see if you feel comfortable and that it's a good fit and that you feel safe. That's very, very important. And often it's important or very helpful to involve family members. If they can hear in the setting of the office what you're going through and can get information from the provider that informs them, they can be greatly reassured and can be of more help to you.